Yeah,
Hello, sir.
hello.
Hello.
Yes, am I audible?
Yes, sir. Yes, sir.
Okay. So let me just check the screen if I share. Am I given the rights to share the screen?
Yes, sir.
Yes, Amma. Can you see the screen
No,
now? Not yet?
not yet.
Shravani, you have to stop sharing first, then only Shar can able to share.
Okay, okay. So, okay, wait. Yeah,
Yes,
I
sir.
can see sir screen.
Fantastic.
Yeah.
I'm stopping my share, okay? And
Yes.
audio is clear.
Okay, sir.
I'm able to stop my screen share. Yeah. Okay.
Should I start my screen sharing?
Yes, you can start now.
Yeah. Is it visible?
Yes, it is visible.
Okay, so should we start?
Yeah, or we can just wait for 2-3 minutes
Okay, okay, ma'am.
enter. Okay, we can start with the introduction. Dr. Sharwari.
Yes, okay. Mm. Sir is not here or what? Dr. Hardik, sir. Yeah.
Yes, he is there.
Am I visible? No. Just problem.
No, yes, now you are visible. Yes.
Yeah. Good afternoon, everyone. Good afternoon, sir. Good afternoon, ma'am.
Good afternoon.
Okay, so I welcome you all on behalf of Asha Homeopathic Academy, which is situated in Indore, established in Indore. The founder is Dr. Vaibhav Jain and co-founder is Dr. Yamini Ramesh, ma'am. What happened? This is not. So we have organized webinars, seminars, weekly classes, online courses, case discussion groups, and group book readings. It was established in 2017. And the journey has been so far, like before lockdown, we have been doing offline classes and seminars. But after lockdown, we have started with online classes and webinars. And the very first ambitious course which we started was NEEV the Foundation course, where we taught many homeopaths all around the world, including Germany, Romania, UK, Canada, and etc. In 2021, we started our e-clinic setup program. Then we held clinical diaries for homeopath, there were 10 webinar sessions happened once a month over a year, each on every Sunday. Homeopathic Junction. So this is the page which is started by Dr. Vaibhav Jain sir on Instagram in year 2020. Here we are putting all of the updates related to homeopathy, like anything related to homeopathy, jobs, events, quizzes, books, courses, anything. So if you want to share anything related to this, you can contact or you can DM on this page of ours, so we can promote it. This is a unique platform where you can send anything. So do follow Homeopathic Junction in Instagram. So today we are here for cancer webinar series. So there are in all 5 sessions, which will be held every Friday at 3 p.m., which is starting from today onwards. So today is our first session. Also, you can watch all these sessions on YouTube on our channel, Asha Homeopathic Academy. So you have to subscribe that channel for your further notifications and updates. Presenting Asha Homeopathic Academy, and we are collaborating it with Vitality Homeopathic Clinic, which is headed by Dr. Hafiza Malik. So we at Vitality Homeopathic Clinic provide a one-stop solution to a proper means to achieve the health most people desire. We strongly believe that a healthy outside starts from the healthy inside. After accomplishing a long continuous study on a role of homeopathic medicine in children with special needs, we have developed our expertise in the management of Down syndrome, autism, ADD, ADHD, epilepsy, and children with learning disabilities. Dr. Hafiza Malik is a consultant homeopath at Vitality Homeopathic Clinic, Surat. She is a doctor of medicine in homeopathy, MD, from Sardar Patel University, Gujarat. She has experience of over 7 years of practice in the field of homeopathy. She has successfully managed large number of cases of Down syndrome, autism, ADD, epilepsy, learning disorders with special needs at the Vitality Homeopathic Clinic. She also has special interest and successfully treated cases of female disorders, clinical disorders, allergic diseases, autoimmune diseases, and cancer. Her special interest in serving humanity by providing better health to I can't see this. Very sorry. To the community leads her to work with various NGOs and welfare trusts too. Her interest in consulting in homeopathy over the internet came in response to a growing number of patients who had been contacting her from different states all over the India and overseas. We thank ma'am for helping us immensely with organizing this special webinar. And this idea is mainly of her. So thank you for your support, ma'am. So we welcome our today's speaker, Dr. Hardik Khamar. Dr. Hardik, sir, is an MD homeopath, PGCHFWM from New Delhi, SCMT, Germany. He has certificate in design thinking and innovations from IIT Delhi, pursuing PhD homeopathic physician. Sir is practicing homeopathy in Ahmedabad since 17 years with an in-depth clinical knowledge in treating various diseases and exposure to a variety of clinical researchers, academic and administrative activities. He holds special interest in treating neurodevelopmental disorders like autism, behavioral disorders, epilepsy, and etc. Cancer. Also, advanced diseases with homeopathy and multidisciplinary approach. He's a visiting homeopath in National Institute of Design in Ahmedabad, visiting professor at Dr. V.H. Dave Homeopathic Medical College, Ahmedabad, Prayas Homeopathy and Cancer Research Foundation. He has presented research studies in national and international conferences. that is 75th World Homeopathy Congress, Turkey, Ukraine, 𝐚𝐻𝐚𝐻𝐿, Kochi, Patna, Mumbai, and etc. He's trained in Germany for special mistletoe therapy in managing cancer, trained paragliding pilot with 200 plus flying hours and participation in national and international paragliding competitions. We are very grateful for you, sir, for your special time, valuable time, and the cases and the knowledge which you will be sharing with us. So welcome and thank you.
Thank you so much, doctor, for the introduction.
Over to you, sir. I'll stop sharing my screen.
Is my screen visible to all of you?
Yes, sir, visible.
Yes, sir.
Got it. So thank you very much, Dr. Yamini, Dr. Vaibhav, and Asha Academy, Dr. Rafiza, for inviting me. It's a subject which is favorite also, not so favorite also. Why it is favorite? Because lot more to do in the whole ecosystem of cancer and homeopathy, and lot more failure. So sometimes you don't like this topic to touch as a homeopath. And if you go to allopath or if you go to any person, cancer with homeopathy, the first thing would come, why you want to do this? And this was started, like this for me also. Very initially in my practice, first 4 or 5 days of my practice, and I get a call of a patient that, please come and see my wife, visit her at home. And I can see a huge tumor here, and I just completed my MD, 4th or 5th day of practice, and you get to see a patient of huge node in neck. And the first reaction was I was scared. I wanted to deny, but then on the courtesy, let me try something. And I started whatever I wanted to. And the patient passes away in 10 to 12 days. I get this bad news. And that day, something, you determine yourself that why you want to do this work. Your cases of cold, coryza, asthma to treat, arthritis to treat, you're going to get those patients. But then this small case, completely stopped me of taking some challenging cases. So this is a short story which I would like to tell. And today, we are in and out treating a lot of cancers with homeopathy, with success, failure, whatever we'll see in the cases. So the topic what we are going to discuss today is homeopathy and cancer. We'll try to see what are the challenges a homeopath can come through, and we'll see what possibilities we as a homeopath can have. So if we can open some sharings, when cancer comes, what comes in mind? If anybody can share, maybe 1 or 2 or 3 participants, we can unmute and take a sharing from them. Am I audible?
Yes, sir,
Yes,
yes.
sir.
Yes, I would like to hear from 1 or 2 participants, when cancer word comes, what things comes as a homeopath's, mindset, what comes?
Yes, we have Dr. Ashish is telling something. We will mute him.
Yes,
Unmute.
go ahead, Dr. Ashish.
Please unmute Dr. Ashish.
When somebody gets detected with cancer, the first thing that comes to the mind is going to pass through a lot of painful mode of treatment, is going to shed a lot of money, and however the family is not sure if he's going to survive or not.
So very good, Dr. Ashish. First of all, survival comes in the question, and what pain not only the patient but the whole family passes through. Very good. Thank you for sharing. One more participant.
Dr. Poonam Bhatia.
Yeah, go ahead, Dr. Poonam.
Can we unmute her?
Hello.
Yes, Dr. Poonam.
The thing which comes to your mind is suffering and pain.
Yes. So suffering and pain, right? So
Yes.
got it. Thank you, doctor, for sharing. So when cancer word comes, then chemotherapy comes and radiotherapy comes. Life expectancy, as Dr. Ashish told, and you, doctor, told about pain, whether surgery is an alternative, diet is an alternative, radiotherapy and what not, family passes through. And what is the role of an alternative therapy? We are an alternative therapy still. Maybe we may be mainstream, but still we are alternative therapy as far as oncology is concerned. अब ये सबके अंदर where a homeopath is, is it? So how many of you remember or can recall aphorism number 3? What's that? It's about knowledges, right? So are we equipped enough to treat cancer first of all? We are doing a webinar. It looks very lucrative. Okay, some session is going to happen on cancer, but let us talk about some ground reality. Let us have a knowledge check among ourselves. Where are we? We want to fight this war, but do we have the weapons? Are we equipped enough? So let us share from that perspective, and then we can move ahead. Let us have an overview of cancer in a nutshell. The data keeps changing and it is bad every day. Whatever you see in front of the screen, 1,300 people, Indian, die daily due to cancer. And mortality is like extremely increasing. You can see it is 6%. Having said that, in next 10 years, India is going to be capital of cancer patients worldwide, which is right now ruled by West. Thanks to many other things, we'll be discussing that later on. The question comes, is cancer curable? Is cancer curable with homeopathy? Is chemotherapy or radiotherapy or surgery needed? Can homeopathy cure cancer? Can homeopathy go along with the other therapies like chemo, radio, surgeries? So these are a couple of questions a homeopath passes through. And I hear that, we are here a various bunch of, we are students of homeopathy, we are practitioners, senior, junior. So we try to integrate, whatever, experience which I can have. So in this scenario, what a homeopath has to offer? What are the scope? What are the challenges? Let us explore. So I completely owe my journey to Dr. Sudhindra Sarkar, whom I got equipped with, to treat cancer. Seeing his experience working with him, and the inspiration source was Dr. Shruti, who is going to be in the next seminar. She was already working on cancer, and that's how we, started working more deeper into these cases of cancer. Let's start with some basic of oncology. So cancer is a group of disease characterized by uncontrolled growth and spread of abnormal cells. If the spread is not controlled, it can result in death. So that says abhi ko dar lagta hai. When cancer comes, survival is the question. So as a homeopath, even if you're able to understand this, even if you're able to control this definition itself, uncontrolled growth and spread of abnormal cells, what we can do to curb this? If we understand this, we treat cancer. Characteristics are abnormality, uncontrollability, invasiveness. Now, patient can come to us in any of these stage or mix of these 3 stages. When it is invasive, we call it as metastasis. Usually, they are stage 3 or stage 4 cancers whenever there is metastasis. And expectations, believe me, rise very high when a patient is coming to you at this stage 4 cancers. And people consider you as a god or whatever, and you have to deliver. And these are some practical things which patient comes in chamber and tells you. There are some risk factors associated. Why India is going to be capital of cancer cases worldwide? Because we are so much now prone to smoking. We see a lot of smoking behavior in youngsters. We see a very, very huge change in our diet patterns. We are shifting away from our basic diet, like rochi tapak, choti chapane. We are shifting towards more of a Western kind of consumption of food. Our food is also having a lot of fertilizers and pesticides, which actually responsible for the genetics. Because genetics is playing a huge role, and there are a lot of mutations which are happening. So nowadays, when we see that cancer patients are increasing, it is because of the mutations which are happening. And we have seen this in COVID. COVID is like complete. A lot of mutated viruses are coming in these days. Occupation environment, the pollution which we're living in today, it is not as healthier environment which used to be 20 years back. And there's a big role of infectious agents which is widely neglected, even if it is not present in our knowledge as far as homeopathy is concerned. So most of the cases will be around this. Another thing, how to categorize a cancer. I'm just taking some very basics because people can understand, get a crux of what actually cancer is. So cancers are namely, according to the organ which it is originating. For example, it is starting from breast. That means it is a breast cancer. even if it is in another part, but usually we tell breast cancer and then it is metastasizing to another part. So usually this is how the nomenclature happens. And it is also nomenclated according to the tissue which is affected. So we'll go through, to some histological aspects of this. Histologically, cancer can be classified into two ways. One is the histological type, and another is by the primary site or the location of the body where the cancer first developed, like I told before. From histological point of view, 6 major ways we can classify cancer, whether it is a carcinoma, whether it's a sarcoma, whether the myeloma, whether it is leukemia, it is lymphoma, or there are mixed type of tumors. So our treatment pattern also changes accordingly. Our drugs have certain affinities for certain types of tumor. So certain drugs are more of a carcinoma, certain types of drugs are more of for a lymphoma. So categorizing cancer is very, very important. Just believe me, aphorism number 3. Keep aphorism number 3 in background always when treating a cancer. It is not just the medicine. Physical examination is very important, while making a diagnosis, because some surface tumors can be like diagnosed with the help of and we get in doubt. And there are certain blood tests which are required. Particularly highlight would be about the tumor markers, because tumor markers will help you as and when necessary. Whatever treatment you are giving or the oncologist is giving, it will be majorly marked by the tumor marker. A very common tumor marker is PSA, everyone knowing in CA prostate. So we'll always keep checking PSA, maybe monthly, 2 monthly, 3 monthly, as and when required, if prostate cancer is concerned. Another imaging tests which are very helpful, primarily CT scan, bone scan, MRI, and nowadays, it is PET scan, ultrasound, X-ray as and when necessary, and biopsy as and when necessary. So PET scan, usually it is helpful whenever we want to see the metastasis and the spread of the cancer. So these are some, like some kind of toolkit whenever we are going to treat a patient of cancer. So these are certain very important tumor markers which I want to highlight. The HCG, calcitonin, we see in carcinoma of thyroid, then catecholamides in pheochromocytoma. But let us go to some commonly, the enzymes which we know tumor marker. That is, one of them is alpha fetoprotein. We also see it is with a positive in cirrhosis and also hepatocellular carcinoma. Then CEA, carcinoembryogenic antigen. We see it as rising in cases of colon cancer, pancreas cancer, lungs, and then PSA in prostate cancer. And there are lactate dehydrogenase. We saw it in corona, certain inflammatory changes, but it is also very, very active during the lymphoma. Then CA125, CA119. These are some of the tumor markers which should be, we should be able to read these tumor markers whenever we are making a diagnosis or when we are starting to treat this patient, and in the following visits when a patient comes to us. So let us start with few clinical cases, so that we can have an idea of, what a role homeopath has to play. Believe me, the cases which I am going to show, they are cases which are improved. Okay, there may be 10, 20, 30% of the patient which I am treating or we are treating together. But then there are a lot of cases where we have failed. That is a very different topic. We can discuss it later on. But let us focus on some success stories, little bit of whatever we achieved with whatever experience with homeopathy we have. So let me start with a very interesting case. This case, a case of CA adenocarcinoma of lung. Now, this patient, got operated whenever she came to us. The right lung was already operated, CA lung. So how it started, she has very severe difficulty in breathing while climbing stairs, walking, tingling numbness in the right hand, and she can only sleep for 2 hours, and then again she would sleep. I'm just giving a brief history of whatever 1 or 2 hours history of we have taken, but these are the positive points. She had excess gas, acidity, and hysterical irritations, continuous. Now, we started with a medicine called bleomycin. We started with the medicine called agrimony, and later on we shifted to asafoetida. Now, accidentally, this patient diagnosed with cancer after, she was been bitten by a monkey on a journey to Vrindavan, and the monkey bite was so massive that her whole chest muscle was also been bitten, and the rib cage was also been injured. So the doctor decided, let us take a preventive X-ray of chest, and they could find that there was a huge tumor, almost 70% tumor in the right lung, and no other symptoms apart than difficulty in breathing. So point which I want to make is cancers can be as silent as this. And this is a case of a female. So no history of smoking, and she never realized any kind of pain before. Now, the reason for selecting these two remedies, one of them is agrimony. Now, agrimony is one of a remedy which doesn't usually feel pain. And even if they feel pain, they don't share much. And they have always a smiling face and whatever grief inside they are carrying, but they don't show. Now, this was a history we found in this patient. Deep long, she was not having child. She was 68 when she came to us, and very long history of grief, some disputes in the family. And she was one of the member in the family who would be very, very active and dominating and leader in the family. But she never showed her pain to anyone, and she would always be with a smile on her face. So we started with agrimony in this patient, and we started her with a medicine called bleomycin. It's a potentized chemotherapy drug. It is been used to treat CA lungs. It's a potentized version of bleomycin chemotherapy drug. And later on, we shifted this patient to esophageal. Believe me, this patient, we didn't give her any kind of chemotherapy. And this patient had we have a 5-year follow-up of this patient. And patient didn't went to metastasis. Now, what happened in this patient is 2 or 3 months back, she suddenly fainted. And now she has mets in the brain. 6 months back, we did all PET scan and everything was normal. So maybe whatever we wanted to achieve, we achieved with the treatment which we wanted to give. So right now the patient is having this practical thing which I'm telling. The survival rate, whenever we are starting a patient with cancer, the first outcome should be like, your 3 months or 6 months planning and nothing more than that. Particularly when you're taking up cases like this, where the tumor is very grossly, engulfed our body. So when we are able to make a 5-year survival in a patient of CA lung, it's a miracle. Usually expectancy is, whether you start chemo, radiation, whatever, 2 years is the expectancy, mean survival rate in CA lung patient. Now the patient has developed metastasis. Now whether homeopathy impacted or not, that's a separate story. But this is the case which I want to tell. And now the patient is going into meds. Now we are not giving any homeopathy to her. There is another case of CA lungs, 82-year-old. Now this female had difficulty in breathing and fever 9 months back. And she was treated with as that she is having AKT. And then later on diagnosed with cancer lung. Looking at her nature, she is extremely fastidious, extremely workaholic, and she would always smile. There is inward grief. She had 3 daughters and 3 sons, but since few years, she would stay with her daughter. And the son stay in Dehradun. Now, she didn't wanted to stay with son because the son was not taking care. She was staying with the daughter in Ahmedabad. Yeah. First motion, only after taking milk or water, and she has excess desire for ice cream at age of 82 years. Now, these were the pitching pointers, and she was always smiling, mixing with everyone, very communicative. And so we started treating her with phosphorus 02. And later on, we shifted to beryllium met. Now, beryllium met again is a medicine which produces a clinical state of CA lung. So certain doses of beryllium and we started with phosphorus 02. We continued till 06 in this patient. So this patient, again, no chemotherapy, no radiotherapy, no surgery given in this patient. We followed her up, patient much better, no difficulty in breathing, and she gained weight by 5 kg. So this parameter is very important. Whatever treatment you are giving, there is something like QOL, quality of life index, where weight is a priority. The patient should gain weight. And this patient gained weight by 5 kg and her breathing and everything became much normalized. 4 years later, 4 years later, this female died and she had sudden cardiac arrest. Till then, she was on homeopathy. But in this patient, we could help her only with homeopathy. And these were the only 2 medicines which are given and they were repeated as and when necessary. So life expectancy is a major thing. Now, traditionally, if you treat CA lung patient, it is first of all less common in female. But see, both the cases we are seeing which are of female, they were non-smokers. And they were not from the family which were, must exposed to so much smoke or some pollutions. This lady was from Dehradun. So there was no much question of pollution. But now this is a scenario where homeopathy helped. Let us go to another case. This case is of a boy, glioblastoma. Okay. Now, a very long history in this patient. What happened in this patient? When it got diagnosed, he was before having Raynaud's phenomenon. Everyone understand Raynaud's phenomenon, right? And he was treated. And later on, he noticed a testicle swelling in right testicle, and it got to be diagnosed as testicular cell carcinoma. Operated, and then he was giving PEB cycle. PEB is a chemotherapy cycle. I will not go into detail of that currently. But then after PEB cycle, it went to lungs and then with brain mets. Again operated and radiation was given in these patients. Now patient describes himself as very, very helpful. He is very selfless. He like equality everywhere. There is nothing like caste or high and low in selecting friends. He thinks very philosophically as he describes himself. If there is dispute between friend, I never take anyone's side. So equality was always his concern. Everything should be equal. There should be justice everywhere. Yeah, there should be humanity. And this is something, we saw a lot of suppressed anger. He cannot speak bad words, and he forgives people very easily. So these were the same. And since there was history of radiation, and there was also a lot of sympathy and equality and justice issues in this patient, so we started deeply with the patient with causticum. Okay, looking at the symptoms, mental, emotional symptoms of this patient. So we started with causticum, and we also started with radium brome, because since there is a history of radiation. Now, radium brome is one of the very important remedy which is helpful in patients, who are taking radiation or who are going to undergo some of radiation, or those are side effects of radiation. So radium brome acts as a very supportive remedy. And we put him on carcinosin. It is not the regular carcinosin, but it is a glioblastoma carcinosin. Okay, so it is not the routine carcinosin which we read in Bonic, which is a breast cancer nosode. This is a glioblastoma nosode carcinosin. Again, this patient much better, no further meds, and he gained weight. Now remember, this patient is not only on homeopathy, he has taken previous therapies. Okay, but then this is the approach we had to take in this patient. So these patients also improved. Okay, now this is another case. This case of 82-year-old CA prostate. Now I would always say that patients of CA prostate, one of the very a tumor which if a homeopath comes, a patient with tumor when he comes to homeopathy with prostate, we have very good results in treating cancer prostate, because prostate cancers give a lot of time. We can follow it. Nearly every survival, once diagnosed, if it is not progressing, 5 to 10 years of survival, even if you treat or you do not treat. So we have good number of scope in treating cancer patients, because we have time, and usually they come in this late age. So in this patient, CA prostate adenocarcinoma, grade 3, he had increased frequency of urination, fever, chills, and burning. In this patient, we gave a remedy called conium, and then we gave him a very, very, very nice organ remedy called thymol 30. I will come to that remedy later on whenever we find time. But this patient are put on these two remedies. We started with very low dose. He became much better, and his PSA remained under 4. When the last we followed him up, his PSA was 0.04, and still patient is surviving. This is a 5-year-old case which I'm telling. Now this is a case which is very interesting. Dr. Rafiz, I am sure I am not so fast. Dr. Hafiza? Yes.
Yes, sir. You can go a little slow.
Okay.
So
If anyone has any question, just put the question in the chat box. Maybe we can have some kind of a discussion regarding that later on. But as far as these cases are concerned, a lot of detailed states been taken. I'm just putting a snapshot of it. But I've selected those cases where multiple approaches has been taken in these cases. Now this is a case which is EEE negative. Now since there are a lot of students here, breast cancer can be distinguished into various types, whether the patient are having their hormone receptor sensitive patients or their hormone receptor negative patients. Now this is a female of 60 years old. This is the EEE negative, EEE marker which are negative. And EEE marker negative are not a good tumors to treat. Okay. Of course, breast cancer nowadays, from oncology side also, the recovery rates are much more higher than what we used to have 10 years before. And this scene has also changed with homeopathy. Okay, now Dr. Shruti has immense experience in treating breast cancer cases. Okay, with only on homeopathy. Okay, and so but triple E negative tumor are one such cases which are very tricky, which are very challenging, and suddenly something happens. So this case, when they came to us, already breast was operated, lump was removed, chemo taken, and already that some treatment is going on. She is diabetic. Now she is living in a big bungalow in Ahmedabad. Son living in USA, the only son living in USA. Husband and wife, no one in the house. She complained of tingling, numbness, and she used to have dropping of eyelids. Now the eyelid would droop. Again, this patient was having a lot of smiling, deep grief inside, but she never expressed the grief. So she was on methotrexate, the methotrexate which we are using for psoriasis and rheumatoid arthritis. It is a potential chemotherapy drug, and it is very well used in treating patients of cancer. Now we started this patient looking at the whole scene of alone feeling, tingling, numbness, smiling, again hiding the grief which is there inside. And this was the pitching point for us to start this patient with Ignatia. And then we started with curare. Now, Ignatia is a remedy which is from Loganiaceae family. We started with Ignatia, later on we shifted to curare because curare again is a family of Loganiaceae family. But curare is having a lot of drooping of eyelids. If you read Materia Medica of curare, we find a lot of eyelids which are drooping. And there is again history of grief, which is very well a symptom of Loganiaceae family. And later on, we put her on methotrexate 30. This is potentized methotrexate. And then we put her on cisplatin 30. Now, cisplatin is like penicillin of chemotherapy. Like, antibiotic, the first antibiotic was penicillin. Likewise, in chemotherapy era, cisplatin is one of the first few drug, old generation chemotherapy. And this lady was given cisplatin. So to antidote that, we put her on cisplatin 30. Now, cisplatin is sodium platinum, a combination of natrum platinum. And there is Ignatia already going on. And we very well sometimes, put this analogy that, natrum is chronic of Ignatia. So we put her on natrum platinum, that is cisplatin 30. You can see the name here. And we also started along with aloxan 30. Now, she is diabetic, and aloxan 30, one of a very hidden gem in homeopathy. It's a remedy for diabetes. Dr. Sarkar puts this remedy as, this is mixture of natrum, staphylos aureus, where there is lot of suppressions of emotion, grief and everything, and patient is having diabetes. So this is a remedy which can be frequently used in treating diabetes where there is, this trauma, some kind of, which is very much present. Why I am putting this note here? We studied some 120 retrospective cases of our practice. My practice and Dr. Shruti's practice, random case study. I presented this data in Ukraine conference. We were able to find that, nearly 30 to 40% of the patients had some kind of emotional trauma in previous 6 months of development of cancer. Now, this was something which was like path-breaking, like shocker for us that, why we are finding this kind of whether there can be grief or some divorce in a family or some financial loss or some emotion which has never come up. Patients were not able to express this emotion. So these were the things which, actually came up in the study. And we started utilizing this data. We need to have a path. We need to have, a different way, where we can be moving faster in the patient's world. So this is how, we came to Ignatia in this case and cisplatin in this case. Because of this study, we could, enter into this patient. So this patient again, improved a lot. 3 years they followed it up and they decided that now we don't want to have any treatment. But in 3 years, patient was taking chemotherapy, whatever doses are given, but they were homeopathic. Now, triple E negative patients. Again, the question is of survival. Okay, once a patient is diagnosed with triple E, the survival usually is not being considered more than 2 years. The maximum survival rate is considered to be of 5 years. As of now, we still know this patient is on no other treatment, but 5.5 years has been crossed. Okay, but the patient is surviving. So if you are able to reach that 5-year milestone, we are doing our job. Okay, so youngsters and senior practitioners, everyone should bear this thing in mind, how much the patient is going to survive. What as a homeopath we are going to play a role here. If we are not able to do this, then probably we should think other way in treating patients with cancer. So let us go to another case. Now let us.
So,
Yes.
sorry for interrupting, but we have questions in our chat box.
Okay. Can you just let me go through the questions? From where we can read this remedy, repetition of the drug in the case, sir. How often medicines are repeated? So usually medicines, let me talk about the repetition first. So when we are talking about repetition, usually they are given sometimes directly in 30. Directly dry doses are given, but mostly we give doses which are in plussing method. I will tell you regarding plussing method, maybe at the end of the series, we are planning to have some kind of panel discussion among the doctor who participate in this. So we'll take this question that at that time, posology in cases of cancer. But in cases of cancer, repetition is necessary. And when we're talking about LM potencies, in LM potencies are usually given in a rising pattern. Like if you're giving 0.1, then the next should be 0.2 and then 0.4. Till we find improvement, it should be going to the next potency. So it is very, very selective as far the patient is concerned. But some repetitions are necessary in cancer patients. The usual therapy, what we give in routine patient, is very, very different than what we treat cancer patient. Couple of reasons. When patient is coming to you with chemotherapy or radiotherapy, whatever constitutional treatment, you feel that, oh, my remedy is XYZ. For example, Ignatia. You give Ignatia from best of your knowledge and it doesn't work on. Reason is, whenever a patient is coming to you with chemo radiotherapy, the original constitutional state is not active. Because the suppression which has been caused by chemotherapy, radiotherapy, which is necessary at that time, doesn't allow the vitality to react only. So whatever constitutional we give, it don't work. So at these junctures, organ remedies are much of a help. Certain phase remedies are much of a help. So cancer is not just a one remedy thing. There will be series of remedy. You might be reading remedy relationships in Boric. If you're able to appreciate that, every remedy has some kind of related remedies in Boric. If we're able to read them, navigate through them, we can get a proceeding remedy. Like in this previous case, like here, Ignatia, Curare, they are related remedies. Cisplatin is a related remedy. So these are not given everything together. Okay, be very in mind. This is just a sum of the remedies which are given in span of 3 years. It is not given everything at the time. Okay, yes, Aloxan was going on longer. Am I clear? Doctor, are you clear whatever I'm telling?
Yes, sir. And yes, and one more question. Sir, we can take question answers at the last 15 minutes.
We will take that, but let me answer this question first. How are the results in metastatic cancer? It's a very huge topic to debate.
Yes.
This is a study which is, I am only showing cases which have improved. Okay,
Yes, sir.
I am not showing you cases where I have failed. Okay, so the data collection in homeopathy is a major challenge. Maybe in the last part of today's session, I will be addressing that point.
Yes, sir. Yes.
So whoever has asked the question, please be in the session till last. It's a very big debatable topic. So let me shift the gear again. So can we move ahead now? Dr. Afiza will take questions at the end.
Yes, sir. Last we'll take
Yes.
questions.
So whatever we are discussing are only the scopes and success stories currently. Okay, there are loads of cases where I only failed, and with the same approach, they have not worked. Let me be honest about it. Okay, so this is a case of CA uterus. She had bleeding in since 1 year, dark maroon kind of bleeding. He had some intestinal operation we didn't remember years back. She had, desire for fruits, chatpata food. She is very social, like to talk with people, very laughing, with everyone and wants to talk, and people likes, and she likes open air. This patient, no chemo, no operation, no radiotherapy. Now see, this is very much nearer to phosphorus, the previous case what we did. Okay, again, that was a case of breast cancer, this case of uterine cancer. Now this lady at the age of 80, when she had bleeding, she started complaining to her family members that I have started menstruating again. And she was worried, and the patient's relative doesn't wanted to tell her that, you are suffering from cancer. And the lady was from that, okay, I'm menstruating again, do something for it. Why it is happening at this age? Happy go lucky, we followed up this patient with phosphorus. 2.5 years of follow-up, and she died peacefully, okay, of a cardiac arrest. So chemotherapy patients or not chemotherapy patients, but cancer patients, many times we see the frequency of cardiac arrest very fast. The reason is, when the tumor is active, what happens? The tumor material gets shred up very easily, and it is very quietly, the emboli goes into the blood, and patients have, the thrombus will move, and patient will have cardiac arrest, or they can have stroke or something. So these are very common, effect which we see in cancer patients. Like we think that, abhi to theek tha patient, and he suddenly passes away. The reason is the thrombus, which get dislodged. The tumor material gets dislodged. So the threat of cardiac arrest or strokes is always, you have to be vigilant in treating these patients. There will be a threat of cardiac arrest, and whether patient is on chemo or not. If patient is with chemo, the risk even more increases, because chemo, there is a lot of cell lysis. The tumor cell also lysis, and the normal cell also pass through lysis. So the clotting, because of the platelet suppression, or sometimes there is hypercoagulated. This will cause patients to, have this kind of troubles. Let me move further. Now, this is a very interesting patient. 59-year-old, right-sided CA breast with invasive ductal carcinoma. Now, might be where, this is a ductal, which is breast ducts which are affected. The complaint started with of the right breast, and suddenly evolved with PUD orange kind of surface. You remember? We used to read PUD orange surface, and we used to diagnose CA breast, and she was diagnosed with carcinoma. Radial mastectomy was done. 8 chemo cycles were given with
Sir,
the
your network
now
work issue, I think there is.
now is it okay?
Yeah.
It's okay now, so.
Got it. So should I start from again? Start again the case.
No
Okay.
need, so it just freezed for a few seconds.
Got it. So the complaint started with, like, the PUD orange kind of surface, she could see that, and mastectomy was done. Radical mastectomy was done. Chemo cycles were given of neoadjuvant therapy, and 4-AC paclitaxel protocol was given. The patient survived very well with chemo and with minimal side effects. Sometimes, this itself becomes a prescriptive point. How? Normally, it is expected that, patients do not survive with chemo. Very few patients survive chemo very well. Easily they survive. When this is coming to us, I would consider this as a symptom. We must consider this symptom. How? Because patient's strength, inner strength is very high. Usually I think of remedies like Ignatia or Agriman in these patients. So on PET scan, there was evidence of residual tumors. Radiotherapy was again given, and patient is on oral capecitabine tablet. It's an oral chemotherapy drug. This patient is ER-PR negative. Not triple E negative, but ER-PR negative. Other complaints, she had pain in joints, PIP joints, stiffness of joint, left-sided sciatica, recurrent costochondrite in the chest muscle would hurt her very, very frequently. Often on acidity, taking on other medicines for acidity. Patient gets angry but can't open up or express her anger, can't speak up. Lot of stress in 2010 due to family issues and death of her nephew, but couldn't speak up during that time. And during the whole interview, she was smiling. So this hidden grief, unexpressed grief is very important, untold emotion, unexpressed emotion. One sister had poliomyelitis, brother died due to tetanus, daughter endometriosis, benign fibroadenoma, desire for sweet, and previously chilly and now hot since chemotherapy. These are primary history. And we started this patient with carcinosin 200, followed by Staphysagria 01, with 02 and 203. And we started with a very interesting remedy, phelandrinum. Okay. Now, phelandrinum, the wisdom of Boric. Okay. So me and Dr. Shruti were discussing about this remedy. She highlighted about this remedy. Phelandrinum is water conium actually. Okay, but if you really read Boric phelandrinum, you will find that this remedy is having action on ducts. Primary action on ducts. This made us to think of, that 𝐚𝐽𝐻 is also remedy of cancer. Phelandrinum is having action on drug. Let us try phelandrinum in this patient because ductal cell carcinoma. So we are using this system. Whenever ductal cell carcinoma, if symptoms match, we think of phelandrinum as a remedy. And again, this patient was smiling. So we started with agrimony backflower parallel. And later on, many patients of breast cancer with radical mastectomy, they have a lot of swelling on the left hand because the lymph node has been removed due to surgery. So there is a lot of accumulation of lymph in the left hand or right hand wherever the surgery has been conducted because the axillary lymph node has been removed. So gallium heparin is a great help in this remedy. Barnoville mentions about gallium heparin as a remedy in those cases, as a drainage remedy. We'll talk about some drainage remedy at the end of this session. This patient much better, survived well on chemo. She developed of constipation due to chemotherapy. So whenever a patient is ongoingly having chemotherapy, we must think of two remedies, ruta and uranium nitricum. These both remedies given together along with chemotherapy, the patient's survival with chemotherapy is much more smoother. The transition time, these two remedies help. Thanks to Dr. Sarkar and Dr. Sujit, who suggested these two remedies. Since then, many times we are giving these two remedies whenever, patients are undergoing chemotherapy. So, one more case, right-sided ductal carcinoma. Okay, 2016, this patient came to us. Again, operated. When they came to us, it was 2016. Now, recently diagnosed with lung mets, and there was a cervical node, and she was diagnosed with small cell lung carcinoma. See, patient has a lot of giddiness, difficulty in breathing, diabetes, psoriasis treated with dermatologist in past, hypertension. She always loathed her appetite, aversion to sweet, constipation, and then bowel motion after tea. History of renal calculi, piles, 3 full-time deliveries, no abortion, no pregnancy complication. She again doesn't tell anybody regarding her complaint. Didn't tell about her present complaint as there was marriage in the family. Fastidious, dominating, masking with smile. Husband died of CA throat. Now we thought of couple of remedies in this patient like Oromars, carcinosin, puja, sanguinaria, but we went to phelandrinum here. We started with phelandrinum and we started with cadmium cell. I will tell the reason later on. But then again, ductal carcinoma and phelandrinum. Now I have written something here, plussing. Okay, one doctor was asking about the pathology in cancer patients. So plussing is a method. If you read aphorism number 248 in Organon of Medicine, where the method of divided doses have been very well described by Dr. Henneman. Write it down, aphorism number 248. Read it 10, 12, 20, 30, 50 times till it gets in your head and try in your practice. Same dose can be divided and it can be risen. A degree of potency can be changed. So it's a method, we use it in almost every patient, but we have started with patients of cancer. Now, this is not a popular method because we do not know. But if you have to get a dry doses, control the aggravation, try plussing method. Later on, we shifted her to Oromars, agrimony backflower, patient much improved, difficult in breathing much better, cervical lymph nodes better, and after 3 months, 1 year, patient suddenly dies of MI. Okay, now see, this is a challenge. Patient is improving, and in a follow-up of 1 year, patient dies. Now, whether it's a success story, it's a failure story, that is a different conversation. But this is a history which I am telling. Dr. Hafiza, should we break it currently? And because I have a couple of cases to show, I can move to the approach directly.
Yes, sir. We can carry forward on 10th March or later.
Take certain cases, later on, because there are many cases I want to show.
Yes, sir.
But then let me take some maybe 8 to 9 still cases, I have to show. But then let us go to the
practical approach. Yes, sir.
Approach to cancer patients, So this is a mix of, mixed bunch of cases, variety of cases of, cancer of lungs and esophagus and everything. But, let me go, what approach usually we take at our center. Various facets to be considered in treatment of cancer with homeopathy. First, early detection of cancer and homeopathy treatment. Whether homeopathy along with chemotherapy, radiotherapy and surgery, that will decide the course of the treatment. And you will have a patient who come after chemotherapy, radio or surgery. And yes, pain, Dr. Ashish was telling about the pain management. Patient only come to you pain ka theek karke do, because they pass through severe bone pains. Then there are some patients who require only symptomatic management. There are patients who will require side effects of management. Some patients will only require psychological management, and some patients require palliative treatment. Stage 4 patient, many times, you just need to palliate. How to do that? Approach, again, very basic approach. Take a very detailed clinical history. I have showed you only one-page cases, but in each case we went through 1.5 hour of history taking. Very detailed clinical history is required. Proper anamnesis of the case. Okay, if you really want to understand what is anamnesis, I would my go-to guy is Dr. L.M. Khan. Read a chapter of anamnesis from his book Pleasure of Prescribing. You will understand the value of your past history. Anamnesis of the case. Searching for the causative factors. Detailed assessment of the magnitude of the cancer in the patients. Knowledge of oncogenes in the given patients. Like many are having history of tobacco chewing or smoking. These are oncogenes. The knowledge of available treatments like adjuvant chemotherapy, radio, surgical measure, prosthetics. See, believe me, we are the late entrants in treating cancer. Okay, there are already existing therapies which are highly developed, and there's a huge amount of investments, research, money, everything has been already been done since years. So again, knowledge of homeopathy aphorism number 3. These knowledges are important. Sometimes patient is throwing up with constipation, like a chemotherapy drug like vinkistrin. Severe constipation after vinkistrin. You keep giving constipation remedies and they don't work because vinkistrin is going on. What to do at that time? You need to change the approach. The constitution would work only. So most important part, what needs to be treated in the case. I would always say, see, if you want to eat a grape, you can eat a grape at a time. But if you want to eat an apple, you cannot eat apple at one go. You have to eat apple bite by bite. Similar is in treatment of cancer. You have to go bite by bite. Treat one thing at a time. One follow-up at a time. For me, every follow-up is a new case. For me, rather, I'm saying this because Dr. Sarkar says, I'm just copying him. Every new case, every follow-up is a new case. And believe me, it's a teamwork. You're not alone doing the job. Take support of other people. Go when you are stuck up. Okay, particularly you are new or you are an old homeopath. Teamwork is mandatory. Without teamwork, you cannot treat these patients. One quote from a book, if nothing happens, nothing happens. Mostly in the cancer patients, you will find some kind of, something happened, and that's how patient develop cancer. Now for that you have to be very vigilant in taking cases. Try to find out, do good anamnesis. Try to find out the hidden cause, underlying cause. Now oncologists usually won't go for this. The only thing, what they would do is a genetic study if required. They will ask the deeper past history or family history, or there is any habit of tobacco smoking or alcohol or any other or environmental exposure. But apart from this, there is a huge role of emotional interplay which is going on in patient's mind, and sometimes they are indirectly responsible for emergence of tumor, and of course the kind of the oncogenes which we discussed. So let us move ahead with this quote. If nothing happens, nothing happens. It is okay till everything is been hidden underneath. But if that, that buch khul gaya, it can erupt. Like, a bomb can explode. Cancer is like that. Case taking pointers, whenever you are starting to treat a cancer. Detailed ODP of the case. You need to see the active symptoms and the active pathology. Progress of the cancer, the TNM classification, metastasis, which organs are involved. Sometimes the organs which are affected decide the remedy, particularly in cases with metastatic stage 4 tumors. Investigation, you need to note down each and everything. Chemotherapy and radiotherapy status or other drugs past and present, because this kind of drugs doesn't allow you the constitutional state to even fulminate or even to elicit the constitutional state. Many patients, where you will get easily constitutional symptoms, and some cases you hardly find any symptoms. So to think of starting organ remedies or some specific remedies, that type Boger approach or NES approach is very, very helpful. History of any injury, trauma, psychological or physical, very important. Addictions, chemical exposures, occupational hazard. This should be a never miss. You should make it like a checklist. Cancer का history लेना है तो इतना तो लेना ही है. Don't miss. See, it is easily said, but when we take a history, these all things are often missed out. Detailed past history and family history, and every second prescription is like a new case because the picture changes, or it may not change at all. Okay. So cancer patients, treatment is not just clinical with homeopathy; it's a clinical management. Various facets, has to be treated. You should have a kind of bird's eye view of the case. Like a bird sitting here observing the whole New York City in front of you, and he then decides where I want to fly. So जितने टावर दिख रहे हैं उतने सिम्टम्स है या पैथोलॉजीज है. You have to pick up what is the current need to treat. And how Herringlow rightly said, you have to go reverse. What emerged last should be treated first. It is very well applied in patients of cancer. Treat what is treatable first. Sometimes there is not a time to give a constitutional remedy. You need to treat something with organ remedy or a specific organ specific remedy. And then a time comes, you administer a constitutional remedy. And there are cases where we have very clear-cut symptoms, no other development, you can right away start with constitutional remedy. So overall picture of a case, bird's eye view is very important in treating cancer patients. So what to treat, and what not to treat, which case to refuse. This is, is very important. See, type of cancer, sometimes you need to take a palliative approach. Sometimes, just local symptoms are predominant, like ulcer, necrosis, fulminating growth, and which are actually troubling the patient. Take care of that. And there are constitutional symptoms sometimes which are prominent. Then psychological management, psychological reassurance, cases without chemoradisurgery, and there is IPD management. So multiple facets, when you will be called to treat a patient of cancer. But there is always a thin line, which cases to accept and which cases to refuse. Decide that on your capacity. Take help of others if you cannot decide. These are various approaches which we are taking, constitutional approach, then sometimes organ remedy approaches. Like then there are various mother tinctures, which we normally do not use in practice. But here, yes, they play a major role. Like Plantaco plays a major role in treating oral cancers. Mother tincture I'm talking, gargle and orally taken. Agrimony, a huge help. The remedy which I told recently, that drainage remedy. Okay. Gallium heparin. Mother tinctures have a huge role. Beck flower remedies, drainage remedy, biochemic medicines, local treatment, external application. Sometimes you need isopathy, non-healing ulcers or non-healing pus discharge from the tumor. What you can do, take that pus, potencize it, make some 3x, 6x or whatever you can go, and then treat. Okay, sometimes it is a great help. You have to potentize some medicines on your health. Like in a case, a patient was going through a cyclophosphamide chemotherapy drug. I didn't add, and the patient was passing through deep side effects of cyclophosphamide. What we did, we took cyclophosphamide from the patient and we made it till 12x, that's 12C, and we gave her. Okay, so we prepared cyclophosphamide 6C at our clinic, 12C at our clinic only. And another important aspect, which we are very, very primitive stage currently, is developing homeopathic protocols. Okay, like chemotherapy drug, there are set protocols, there are manuals. You go to US, you go to Bangladesh, or you go to India. The protocols will be same. Okay, but we do not have such protocols. Okay, because certain remedies are having affinity for certain kind of tumors. If a protocol has been designed, maybe after 1,000, 2,000, lakh, 2 lakh cases, we can conclude that conclusion. And it becomes easier for the other generations, you can use this experience. As of now, if you ask me, then like a remedy I told about phalandrinum, ductal carcinoma, in the protocol of treatment, phalandrinum would be there in my kit. This is how we approach cases. So these are some path-breaking contributions by our own authors. We should read them. Like Arthur Grimmer is one such homeopath. A hidden gem We do not know the work about Arthur Grimmer so much, but he has done some pathway. At that time, he's known that he treated nearly 50,000 cases of cancer. High cases, we do not have the literature. But go through Arthur Grimmer's book, you'll find some amazing literature. J.H. Clark, path-breaking work on cancer. Burnett, and one of my favorite is Bernowell. Okay, he talks about lot of organ remedies, drainage remedies. Then there is Rademacher solution, very helpful. You must read that. So some of that, yes.
Yes. I would like to show the cover page so everybody can cover page of the my video is everybody can see my video.
Yes, ma'am.
Yes, so this is what sir is talking about. Am I right, sir?
Yeah.
Yeah, this is also very helpful. So in this drainage remedies, someone was asking where to read all these remedies. So drainage remedies and other remedies you can read from this book. Yes, thank you.
Thanks, Dr. Rafiza. Thank you so much for that. So some excerpts from the Grimmer's work, like cadmium fluor, very important remedy, for prostate cancer. Okay, it is a genius remedy. It is out and out contribution of Dr. Grimmer. You can read this remedy. Okay, then sister scan, it is given in your boric. Now, sister scan is having primary affinity for lower lip. Of course, breast cancer, but lip is the affinity what Grimmer positions it. Thus, thiocinaminum, it's a very important remedy where adhesions has been taking place. Thiocinaminum people use for treating keloids. Okay, but when there are adhesions, thiocinamin is one of the prominent remedy what Dr. Grimmer suggests. There is a very, very well-known remedy called Califos. Everyone knows about Califos, a remedy which is very well-known for sleep, insomnia. Again, it's a very important remedy where there are adhesions, and Califos can be introduced. Another important remedy, I think the color is darker, but if you can make it, it is Syrinum. Okay. Now, Syrinum is also carcinosin nosode. Syrinum patients, it's again a breast cancer nosode, but prepared in a different way. But Syrinum nosodes, many times you will find that the patients are having history of worms in their childhood. And if patient is coming to with some kind of cancer, rather than thinking of a main cancer carcinosin remedy, think of giving Syrinum. It is a valuable tool. And these are a couple of other remedies like cadmium iode. I don't know why the color has been changed, but these are a couple of the remedies which Grimmer will always be handy. Now coming to Bernowell's work, to treat cancers, your work is incomplete if you are not referring Bernowell. Path-breaking work by Bernowell, path-breaking work. Like he suggests some of the remedies like gallium heparin, ulcerated tumors, and again, for the drainage remedy, radium brome, his suggestion, antidotes the bad effects of X-ray radiation. Okay, that's scrophulina nodosa, a remedy very much like sister scan, especially on cancers of breast, uterus, skin. So there's some organ-specific remedies. Then one remedy which is very important. Currently, I'm treating one patient of CA stomach with ornithogallum, Star of Bethlehem. Star of Bethlehem. Now, ornithogallum is also given in boring, but ornithogallum helps the patient to survive the shock after the bad news of cancer. It's that kind of remedy. That is ornithogallum. Very interesting remedy. Again, ornithogallum, not a remedy which has been frequently been known by homeopaths, but is having affinity on stomach cancer. But the patient goes into trauma, knowing that now I am having cancer, think of ornithogallum. Another interesting remedy, Fuligo lignum, for epithelium of the skin and particularly uterus and scrotum. It is the soot in the chimney. It is a potentized soot in the chimney. Bladder cancer, very important remedy. Pundurango, again, very important remedy for stomach and intestinal cancer and oral cancers. Now, cinnamon, okay, our daily, kitchen spice, cinnamon. It is a very important, valuable tool to manage pain and hemorrhage. And particularly for having fever in the mouth or wherever there is an ulcer, think of cinnamon. Okay. Another two, remedies which are very important. One is citrus lemoni and citrus santal. Okay, now one is orange and one is lemon. Okay, if you read in boric citrus, all citrus fruits are valuable pain management remedies for cancer. Now, when I talk about citrus lemoni, Ruta is also one of the prominent remedy. Dr. R.P. Patel famously puts about Ruta as a remedy for CA rectum and also for brain tumors. And we have seen previously, Ruta been suggested by Dr. Sarkar and Dr. Suji Chatterjee for patient having chemotherapy. Ruta again is a Rutaceae family. Citrus lemoni, orange, they all are Rutaceae family. So Rutaceae family is having a strong affinity, very strong affinity for malignancies. This should be kept in mind. Burnett's work, these are a couple of the remedies, where there is history of trauma. Think of Wellispur, another one remedy, Lappa minor, okay, suggested by Biner. And one such remedy, Oromur netronetrum for uterine treatment. For me, Orum or netronetrum is remedy where, I am confused between Orum, Staphysagrea, netromur. And there is cancer. If I have mixed bunch of these three remedies, I think of Oromur, netronetrum, invariably. Okay. The scrophulera nodosa again for tumor, then interesting remedy for rubia tinctoria. It can be good medicine where you want to increase the hemoglobin, to improve anemia. Okay, now Lepisalba, a very prominent remedy, usually people use for lipomas, but it can be a valuable tool for treating ovarian tumors. Kundurago mouth tumors. So let me talk about some of Dr. Sarkar's work. I think we can take it this at the end, Dr. Rafiza. Okay. Because
Yes.
we take some cases, we'll take this at the end, this work. Not today, maybe in the second session.
Yes, sir.
But then these are some prominent remedies which should be there in every homeopath sputtering. We'll take this at the end. Okay. A lot more to say regarding this. Put unput, cancer or malignant growth is the result of a decayed malformed cellular growth. So curing cancer means bio-traveling in the past. Chemotherapy is the second largest profitable industry after petrochemical complex. Most of the chemotherapy agents.
Sorry, voice is. Sir, you got freezed for 2 seconds.
Okay, now.
Yeah, now it is okay.
So put unput, this is a reality. Many times chemotherapy is indicated, many times it is not indicated. Now, a tricky question comes, when patient comes and asks you, okay, can we rely only on your medicine? If we not give chemotherapy, radiotherapy, what? Okay, see, nowadays the chemotherapy remedies are not as nasty as it used to be. Okay, so leave it to patient's choice, what they want to do. If you are judgmentally telling that don't take chemo, we are somewhere breaking the ethics. Let the patient decide what they want to do. And believe me, in treating cancers, it is patient's desire, which matters most. The patient should have. Once the patient knows that I am having cancer, means that immediate threat, okay, when I am going to die, how much time I have. So let them decide. They have all right to decide. You cannot be so much imposing that, okay, mat lo. They willingly will come to you. If you want to take homeopathy alone, give them homeopathy alone. If not, don't hesitate. Still give your remedy, give it along with. Because we can intervene at any level. So it's like, huge travel, we have to go through a patient of cancer. So, kitna percentage result aata hai cancer? Because the patient keeps changing, we need data of 1,000, 2,000 cases from each homeopath to come to a conclusion that homeopathy is this much effective in patients of cancer. Having said this, this doesn't mean that we shouldn't treat cancer. Okay. So this will be my end note slide. Challenges in treating cancer, which comes up, cure. Yes, first patient comes, can we cure cancer? Chemotherapy, radiotherapy has to play a role. The side effects, acute emergencies like sudden deaths. Your patient is improving. What if the patient dies suddenly? And then every next patient is like a new follow-up, new case. Changing, picture of the disease itself. Metastasis. Limited knowledge among us itself. We do not know what is cancer. What are the tools to use to treat cancer? This is the thing which Hahnemann has been facing, and we are also been facing. Discouragement from other systems. Rubbish thing, what homeopathy will do. And this belief itself is among our community itself. Homeopaths do believe. Do homeopaths believe that can we treat cancer or not? Lack of teamwork lack of collaboration among homeopaths. training itself, takes huge time to prepare a homeopath. And then we want to add cancer. And the challenging thing, statistical analysis of each and every case. Each case is different. For me, if you really want to give it a go, there should be only a doctor who treats only breast cancer cases and take data of 5 years. At least 5 year data is needed to give some conclusion. And we do not have that time. Dear friends, we do not have that much time. Record keeping, scientific research, hospital setups, and our provings have a limitation. We do not go to the level of pathologies or toxicologies. So these are certain challenges a homeopath would pass through. As a homeopath system we have. What are the we can directly relieve cure cancer sometimes. We have a huge scope of developing newer medicines, improvement in symptoms, use of various potencies. We are yet to explore the role of homeopathic palliation. Teamwork itself becomes a scope to develop homeopathic protocols. Counseling patients and relatives continues to be in communication, clear communication. Tell what you are doing. Tell what you are not doing. Don't hide your remedies. Patient will ask, "Aap kya de rahe hai?" Tell the remedy. What is the problem? See, I told whatever remedies has been given. What is the problem in telling the remedy, name of the remedy? Disclose everything. Statistical research is a huge scope for us. Newer ideas and methodologies. Collaboration with other systems. Integrative approach. For me, if one word to treat cancer, I would always call it should be an integrative approach. Not a one-man army. It is a multiple-man army. And developing something like cancer material medical, like rheumatoid. Developing improvement scales. Okay. The research and knowledge from toxicology. Wherever proving cannot reach, we can get data from toxicology. Yes, so these are the challenges, these are the scopes, which we need to encounter whenever we are treating a cancer. So I would like to end before we take questions with this very, very nice quote. Doctors are men who prescribe medicines of which they know little to cure diseases of which they know less in human beings or whom they know nothing. Voltaire. So this is the journey of cancer. Little bit of whatever I know, I do, I shared with you. We'll take some of the cases if time permits some later on. But I'm open to questions currently for maybe 10-15 minutes. Or we can get some sharings or what people are passing through.
Yes, we would like to have some questions.
Yes.
In chat box, we are reading questions. Author and book, I will surely share. The name of the book is Homeopathic Therapeutics of Cancer from Master of Homeopathy. And the inputs from the doctors are J.H. Clark, A.H. Grimmer, Fortier Bernaville, and R.T. Cooper. And other drugs, sir, the sir has prescribed are from their research. So, sir, would you like to share something about the?
We can take it, maybe at the end of the
separate session. Yes. So the drugs, chemotherapy drugs that are been potentized, sir will tell. We'll take a separate session, maybe on 10th March. We have not yet decided the dates, but surely we will do that separately because it is a vast topic. And again, I would like to thank Dr. Hardik sir for his precious time and your sharing your knowledge. And sharing knowledge is the only thing that increases by sharing. So we appeal and we request all other doctors also to give their inputs. And I would like to thank him because he is my mentor. He has also taught me material for 3 long years. And I'm really thankful to him. Also, he has inbuilt the confidence in us when we were students. And also my first case of cancer, I'm very thankful to him that he always keep on supporting young homeopaths like us. And because of him, today I'm able to take cancer cases. Also, he keeps on helping us. And it is very true that it is an integrated approach. And we as a homeopathic fraternity should help each other. And even if we face a lack of confidence or fear, sometimes we should take the help of senior physicians, senior doctors, And in spite of taking help from other pathies or sending or referring patient to other pathies, we can refer patients internally. Sir very truly said that if someone is taking only CA breast cancer, then he might or she might have 10, 15, 100 cases of CA breast cancer. So her or his knowledge would be much better. Okay, so if someone has expertise, we should refer them case, or at least we should ask for help. So I'm very, very thankful that, sir, you dedicated your so long research and also shared it with us. There are very, very few homeopaths who are openly sharing on an open platform and also on a free platform like this. We are not keeping any monetary fundings here. So it is very, very rare platform. So I'm really thankful, sir. And also we'll keep on sharing on 10th of March. Yes. Any other questions?
My pleasure to train doctors to share whatever work we have. The only reason is we are a very limited bunch of people on the earth,
Yes.
the planet.
Yes, sir.
What we'll do if we hide our knowledge, what we have?
Yes, sir. Very true.
The more we get.
Yes, sir.
Are we having any questions?
Ma'am, can you write the name of the book? Because they are asking to write the name of the book.
Yes,
They cannot
sure,
recall.
sure.
So,
Yes,
or
yes,
you
yes.
can
I will.
text it, then we can convey it to them. Or
Yes, yes, yes. Sure, sure. Okay, sure. We will do that. There are. It is not just one book. There are many books on cancer. There are. Yes, sir. Yes, sir. Also, there are other about the protocols. There are many other authors also who have written their protocols. You can also use that, right, sir?
Yes, yes. So,
Like,
yeah, because it will be too early to comment on anything because there are 4 other speakers who are going to share their experience.
yes, sir. Yes.
So certain things, if we discuss at the end, it will be good. The only
Yes.
reason, because this is just started. We have just started. Okay.
Yes, sir. One question is, please guide for medicine to increase WBC, medicine for side effects of chemotherapy.
So side effects of chemotherapy can be tackled in couple of ways. One is, take the symptom, which symptom patient is coming with. Repertorize that and give a medicine. Another approach would be you can give a potentized form of that drug itself. So these 2 approach, which we very well, day in, day out, we do.
Also,
if you ask me, where to get the remedies, Helios is giving most of the chemotherapy potentized drugs. If not, get the vial of that chemotherapy drug from the patient. Prepare it on yourself because most of the chemotherapy drug were aqueous solutions. Dissolve it in water, potentize on yourself. We learn it in our first year. The easiest thing should be this, but label it properly. And symptomatic management, like for me, having said that, currently my father just got diagnosed with cancer. And, he wanted that, stage 4 diagnosis directly and no other symptoms before. So we decided to go with low dose of cisplatin, looking at, and whatever constitutional remedies which we are giving him currently. But we could curb the side effects of cisplatin, which is so much of nausea, very well with Ipica. Never we have been, giving him any kind of, anti-vomiting drugs. The practical example which is ongoing, currently going in my family itself. So certain remedies, old remedies are so helpful. If you ask me, which remedies to have, we'll discuss, that this should be in your list. It should be in your kit.
yes.
Some doctor is raising hand. You can take his question. Dr. Ashok Madan.
Yes, Dr. Ashok Madan.
Doctor, good afternoon. This is Ashok here.
Yes, doctor. Good afternoon.
First thing that I must appreciate how big knowledge and you're telling us all these experiences. But with this humble request to you,
Yes,
it was really too fast. This such a big and huge matter that we cannot cover up in 1 hour time that you are telling. We need little, even one word is so efficient in our cancer programs that we need to understand each word from you. You are a master of your section, master of this thing. So please accept my humble request. There might be some more questions certainly regarding this treatment, regarding this medicine, and certainly you will put all these name of the books in the chat box or in the other way that we have written something in front, not only verbally that as doctor is speaking. Next, these programs we are coming, I might be asking some questions, but accept my humble request. Thank you very much.
Surely, I completely agree with you. This is something like, we are giving in a chota recharge. And it's huge topic to debate on, because we are debating is the success stories. What I'm not debating is the failure stories. The whole entire series can be done only on the failure cases.
Both goes together, it must be. Both goes
So
together.
we'll think about it, sir. Surely. Thanks for that, valuable suggestion.
Yes, thank you, sir. Thank you for your input. And we are, yes, that is so true. We are also trying to increase the sessions, but due to the lack of time, we are keeping it in sessions. Okay, we are keeping in it breaks. So our next session of Hardik sir might be on 10th March. Okay, we will coordinate with other speakers also. And next speaker, our next speaker is on next Friday. So we'll also get to know something new about cancer. But yes, Dr. Hardik sir is, I would say his nickname or his whatever it is, like he is the Burnett of homeopathy, because yes sir, because you are teaching with the pathological knowledge and with the modern knowledge, modern science with pathological and materia, all you are correlating how Burnett has written in his books. So for me, you are the Burnett of homeopathy. So yes, your sharing is too much like heavy for other doctors, but we will take a huge time. We will invest our time and we will see to it that we go slowly next time. Okay.
Sure. So let me not be the Burnett, but let me be the burning flame to carry the patent further. But to end with, when we were setting up our foundation, me and Dr. Shruti and Dr. Sarkar, this was a couplet written by our dear friend Dr. Vismay Thakur. We just read it out and then now we land.
Yes, sir.
The walk of crab. We act with soul hands. The effort is nothing but service to breath. Thank you.
Yes, sir.
Thank you, sir, for sharing your wonderful cases with us and enlightening us with your knowledge. Thank you.
Thank you so much.
Thank you all the participants who have given their precious time, and we look forward to next Friday.
Next Friday we will be having our session with Dr. Jyoti Udupi ma'am. So
yes,
we'll see you all at 3 p.m. next Friday.
Okay. Thank you once again, sir, for your precious time. Yes, sir.
Bye-bye. Take care.